Hi, welcome to Walk with the Doc. My name is Dr. Jennifer Chilton, and I am the Interim Executive Director at the School of Nursing at the University of Texas of Tyler. Today, we're going to be talking about an interesting syndrome called alpha-gal syndrome. The purpose of today's talk is to increase awareness about this syndrome, as well as to provide you tips to keep yourself and your family safe. Alpha-gal syndrome was identified in 2009 as a food allergy caused from a tick bite. And the little jerk that causes this is called the Lone Star tick. And unfortunately, he is very prevalent in our areas. What happens in this syndrome, which makes it different than other foodborne allergies, is that the reaction time takes 3 to 10 hours. So oftentimes, the T-bone steak eaten at dinner and the rash in the morning that's a result of it is not identified. What happens is the tick has alpha-gal in its saliva, and when it bites a human, it injects this alpha-gal and it causes an immune response in that person. At this point, we don't know why some people respond and others don't. We do know the more often a person is bitten, the more likely they will become sensitive to this problem. The symptoms, again, can range from mild to severe, and what that may look like is after the food is ingested, a person 3 to 10 hours later will start to have itching, hives. It can even present as eczema. So if you're a person that's never had eczema and suddenly you get eczema after a tick bite, you might want to talk to your doctor about that. You can have your basic sneezing, runny nose, headache, nausea, vomiting, even diarrhea, and the worst case is an anaphylactic reaction. Before we all get scared, how do we prevent this disease? How do we prevent this syndrome from happening? We are blessed with this beautiful environment here in East Texas, and we want you to go out and hike. What you want to do is wear long sleeves, long pants when you're out hiking. After you cover your skin, any exposed areas should be sprayed with the repellent, and it needs to have 40% DEET. If you go camping, you can spray your materials with permethrin. You saturate it the day before, let it dry, and the next day you're safe. So when you are hiking with your family, safety tips are stay in the center of the lane, stay away from the edges and the tall grasses. What ticks like to do is they hang out on the edge and they put their arms out, and it's called questing, and they wait for their host to come by, and that's when they grab you. So stay out of the tall grass. If you have a dog with you, it's best if you keep your pup on a leash so they don't pick the ticks up along the way. Things you can do in your backyard, make sure if you have areas of brush and leaves, you want to keep that cleared out. Again, use gloves if you're going to clear those out. If you have a wood pile, make sure you store that in the sun. Ticks don't like that. You can also use a tick spray in your backyard or even in your house if you get that. Additionally, if you have pets, cats and dogs that are in the house that spend time with you, make sure you use tick prevention with them. If you do find a tick on you, you want to remove it promptly. You will take tweezers and gently pull that off your skin. Take a picture of your bite and of the tick if you can do so. You'll want to keep that as a record to document if you do to start having reactions later on down the road. Notice the bite. If it reacts, it's red, raised, itchy, and painful, and takes a long time to heal, like more than 2 weeks, 3 weeks. That's something you'll want to talk to your doctor about. Make sure that they know that that's going on, because that could be a sign that you're sensitive to the alpha-gal in the tick saliva. If you are concerned, go see your physician, your primary care physician, or an allergist, and they can ask you questions to determine what kind of test you need. If they determine they want to test you for this, they can look at your blood and see if you're positive for the alpha-gal molecule. They can also test you for beef, pork, and dairy allergies. If you are positive to those things, there will be additional tests that they'll do for you. We want you to enjoy the beautiful outdoors. Wear your long pants, wear your bug spray, and do tick checks with your family to make sure everybody doesn't have a tick. Happy hiking!